family members and loved ones will not have because they're connected emotionally.
Absolutely. Darlis, again, thanks for being with us this morning. MK, thank you. And our thanks to you for tuning in. We hope you'll find us again next weekend and pass the word along about our radio program. Special thanks to our producer, Curtis Daniels, and behind the glass. Enjoy the rest of your weekend. Take some quality time for yourself. I'm Russ Morley.
You've been listening to Addiction Today, a radio program dedicated to the better understanding of the disease of alcohol and drug addiction. Join us next week at 10:30 for more guests and a continuation of the discussion of addiction. Addiction Today is brought to you in part by Lumiere Detox Center of Jupiter, where healthy lifestyles are created. Find out more about Lumiere, the first step on the path to recovery, online at LumiereDetoxCenter.com. That's LUMIERE detoxcenter.com. Or call with your questions at 561-755-4357. That's 561-755-HELP. Have a happy, healthy, clean, and sober weekend.
Real Radio 94.3, an iHeartRadio station. WZVR, Riviera Beach. Real Radio 94.3 is available anywhere you go on the iHeartRadio app. Download it now. Real Radio 94.3, an iHeartRadio station.
I'm CBS 12 meteorologist Michael Ehrenberg. Skies for today, Sunday, will be partly sunny. There's a chance for scattered afternoon and evening showers and thunderstorms with a hot high in the low 90s. Skies for tonight, partly cloudy, the low about 74, partly sunny, scattered showers and storms for your Monday. A higher rain chance at 60%, the high tomorrow in the upper 80s. From the CBS 12 Storm Track Center, I'm meteorologist Michael Ehrenberg for Real Radio 94.3. Real Radio.
The following views are those of the host and not those of Clear Channel Broadcasting licenses.
Have you gone to the doctor recently because of pain throughout your body for which there seems to be no relief? Introducing Dr. Anthony Pannozzo. The Dr. Pannozzo Sports and Medicine Hour will bring you a new technique to resolve painful issues throughout the body. Dr. Pannozzo has worked with over 65,000 patients over 40 years and has developed a revolutionary approach to pain treatment. His treatment allows fast and effective treatment of pain without narcotics, surgery, and physical therapy. There is no manipulation or alternative approaches. Weight bearing and the return of normal range of motion without pain is the best kept secret this man has to deliver. So, get ready to call in and ask all of your painful questions and get the answers you've been looking for. Now, here's today's edition of Dr. Pannozzo's Sports and Medicine Hour.
Good morning, South Florida.
Hey, good morning.
Hey, Doc, I didn't say good morning to you. You got to wait till I say good morning, Dr. Pannozzo.
Oh, good morning.
Good morning, Dr. Pannozzo. Good morning, Freddie.
Good morning.
Good morning, Leah, who's busy on the computer. And we have a special guest we're so excited about. Hi, Leah.
Hi, how are you guys?
Leah from the Love Doctors, who's here as the way to help us to give the message out.
Yeah.
So first thing I'm going to do is, I guess everybody out there has Showtime TV, right? Or subscribes to Showtime TV?
Yeah.
Well, there's, everyone heard of Penn & Teller, right?
Yes.
Penn & Teller does a thing called Exposed, and they use the word BS, which I guess everyone knows. I don't want to get sued by using what it really means. And Doc, here's what they said was the worst thing in the world. Reflexology, magnets, and our favorite, the chiropractor.
Yes, well, we've been talking about that a long time.
Well, now it's actually coming to fruition where people are actually understanding that. Here's what they said about reflexology. Does not work. The foot is not the pathway to the body. Have you ever done reflexology?
No, I don't know anything about it.
Well, we're going to find out today from the doctor. He's going to tell us about it. They said there's no medical proof. Is that correct, Doc?
That's correct.
And they also say it does not work on the back or help the back. Medical doctor I can't use his full name, Varick. He said it's the power of suggestion that's fooling all these people with reflexology. What do you think about that?
Yes.
Am I right? I mean, it's just, okay.
Right.
So there's no medical proof that this stuff works.
Or they're being paid for it.
Aha, very good.
Yeah, see, all of these things you're talking about require a diagnosis, a secure diagnosis, before you can judge on what these programs do. You know, if you just have a pain in your leg and you put a magnet on it and somebody says, oh, yeah, it feels better, You know, what is that? You need a diagnosis.
Exactly. And these people, they're not doctors.
This is what we do. We diagnose exactly what your problem is, not only left and right, but up and down, numbers. These numbers are important. L5S1, L34, C7T1, you know, those are all numbers, all reproducible. You can put your finger on every one of them. That's a true diagnosis then. And it takes in consideration the physiology of how that happens. How can you have a diagnosis like that? So there, after you know that, then you can devise a treatment for it. But just to say reflexology, I mean, what is that? Rub my foot? Just, you know, suck on my toe? I mean, what is that?
Doctor, get a little kinky here. We have Leah here. I mean, we don't want to start using the
reflexology, but
well,
that's what
we're
going to talk about.
Leah brings out the best in me, I can tell you that.
What it is?
All I know is I've been eating Reese's peanut butter cookies and Oreo because I listen to a show all the time. You drive me crazy.
They're good. If you haven't tried them, you got to get a pack. I think they're 2 for $6 right now.
Where do I go?
Publix.
Okay, that's right.
Yeah,
Okay.
2
Well,
for $6
shopping
right
is
now
a
through
pleasure.
Thursday.
Unbelievable, that stuff. It's habit forming. Now, we brought Leah here because, first of all, everyone's in love with Leah. And secondly, tell us what your experience was when you met Dr. Pannozzo. I know it sounded like this can't work, but I'm going to come to see.
Right. Well, when I originally had come to Dr. Pannozzo, I had already sought out, I had asked my regular physician who I get my physical with, my primary care physician. He says, are you having any other issues? And I said, yeah, I've been having this weird pain down by my ankle, just above the ankle area on the left side of the leg. And he told me that I needed to stretch more. I thought maybe I needed to go see a podiatrist.
Right.
Upon meeting Dr. Pannozzo, he gave me a thorough hands-on examination, and lucky guy. And
I was actually what I was supposed to do that, Leah, but he said, no, that's not right.
It took longer than usual.
It took much longer.
So we did. We had a thorough examination, and then I was shocked to find out that through just the hands-on examination, before we even took the X-rays, he already knew that the pain that I was feeling was a referred pain that was coming from my lower back. And I must have looked puzzled because that just didn't connect to me. But then we took our X-rays, and he showed me exactly where the problem was, and that I had uneven hips. I didn't know any of this. He also gave me something that I could wear in my shoe on the right side that was going to help straighten the problem out. And then I realized, well, I do kind of feel back pain when I'm bending down a lot or washing the dogs, and I kind of attributed it all to getting older.
Oh my God, you're 26?
I had been treated at 40. I'll be 41.
Bless you. You were great.
Thanks. So then when I was treated, though, Dr. Pannozzo was like, well, hang out for a little bit. I don't even want you to leave yet. Give it some time. I want to see how you're feeling. And I didn't feel the pain anymore.
It's amazing.
Before I left the office.
You can't leave his office with the same pain you came in with.
That's right. I keep telling people that. Yeah. You can't be aging on one ankle and not the other. I mean, it's just not possible.
Right. Well, I just thought it was an injury because of the exercising I was doing. A lot of jumping jacks and a lot of, that's what I thought that it was an injury.
Injury could be.
How long did you have the pain?
It was ongoing for several months. I don't really, I can't pinpoint, maybe up to 6 months. And again, I just thought it was the type of exercising that I was doing, a lot of running, a lot of jumping jacks, and didn't really attribute it to lower back pain because I kind of, I guess, adjusted to the discomfort that I had in my lower back. It wasn't really an issue for me. It only really bothered me when I was washing the dogs and that sort of thing. And again, I just thought, I'm getting old.
No, when you left this office, the pain stopped?
I didn't have it at all. And it was funny because everyone asked me, they're like, are you sure? And Heidi asked me when we got in the car, she said, so really you don't, I was like, I don't feel it at all. I don't feel the pain at all. It's gone.
And did the procedure hurt?
No, I mean,
it's a pinch.
It was more of a mental thing, and it was a pinch. And I didn't know what to expect when I headed into the office, so I wasn't really prepared for it. But I'm a strong individual. It was nothing.
You're a tough guy.
Kind of.
Yeah, I know. I hear you every day on the radio. She doesn't let anyone, when she's got a point to make, she makes it.
Well, the thing I'm interested in is, are you limited in anything you do, or are you able to do more now?
Well, I don't have the pain, and before I did, and so it would limit me. I wouldn't do certain things on a day that I wanted to work out, and I work out every day. So whether it's yoga or regular gym workout, running, walking on the beach, and before it was walking on the beach, every step I took, I felt. I don't feel it at all. I'm at the beach all the time with my dogs now.
Yeah, that's great, amazing. I mean, you got to work out like her if you're going to eat half a box of those
Oreos, that's
Reese's
right.
Oreos,
Yeah.
Well,
I
she
work
has
out
to work
to
out.
eat.
She eats Oreos.
Yeah, I work out so that I can eat.
Yeah, so do I. I work out 7 days a week just so I can eat. If anyone wants to talk to Dr. Pannozzo today on the hotline, or they want to say hi out to Leah, 877-927-6969.
Well, Leah, we had another elderly gentleman that was a retired judge from New York, had a pain in his large toe, almost like yours.
He had a pain in his large toe.
Large toe for 10 years. And he had multiple operations on that foot. And his pain was from the same place yours was from. So he would get this big toe pain walking. But I examined the toe and I said, there's nothing wrong with this thing. Do you feel this? Do you feel that? And I was really rough on him. And he didn't feel it. So I said, well, it's not coming from the foot. It's got to come from the back. So I did the same thing I did for you, what I did for him, or I did for him what I did for you.
Sure.
And he walked out. He couldn't find the pain anymore, walking. So
it's amazing.
These things, you need a diagnosis, and that's what you're trying to tell people. You can't go to a therapist or a chiropractor and expect to get a diagnosis. You need that first. If your general practitioner sends you to a chiropractor, therapy, or any place, he's lowering your standard of care. That means he's letting them make a diagnosis on you, which is wrong. That is unethical for a physician to do that. You're in charge of that patient. You're supposed to take care of him.
Yeah, but why do they do that?
They just get rid of it. I mean, they say, well, let them play with it. I don't know. But, they should...
but they haven't diagnosed the pain either.
Nobody does. That's why it's a waste of time and money.
Well, what happens when you go to the chiropractor and you get a set of x-rays taken and they come back and they say you have lumbar myofascitis in your L5S1? Isn't that a diagnosis?
No.
So they're giving out false diagnoses to patients who think they're being diagnosed?
No, they're reading the film, but is that what's bothering you? Maybe not.
So they're just saying whatever they think it is.
It was the same with... So when we go through that, we go through a whole process of a history. You have to know where your pain is. If you don't know where your pain is, I'll show you the door. You have to know where your pain is. You have to know what brings it on. Otherwise, you're not honest with me, and that doesn't help.
Well, they have to tell you what the pain is. They can't tell you what it's on.
And then we do an examination, which is a commitment. It's a commitment. Like all these things are commitments. If I say my leg hurts, when I bend down, that's a commitment. Okay, that's a positive thing that I can use. Same thing with the clinical exam. Then it's a commitment, and you have to know where that pain is, and we have to know left, right, up, down, whatever it is. Then we take the film. After we make a diagnosis, we take the film to see what's affecting that area, and then we treat it on that basis. So that's the way it works. That's why we can get the pain relief in 2 minutes.
Yeah.
Or 3 minutes.
It's amazing.
That's how it works.
It is.
We have it on film now on the scoliosis.
Yes.
Where the turn of the bone takes place in 2-3 minutes.
We've seen that.
Not complete,
scoliosis.
but it starts, and you can actually see it on X-ray.
Yeah.
Wow.
So how we do that is if somebody has scoliosis and we treat that, we look for the scar tissue and put a shot in it if it's an older person, and then wait 2 minutes. So take a picture, store it, wait 2-3 minutes, and take the picture again, and you'll see the turn take place side by side.
Yeah, we've seen it. We have that on film. That's going to go on his website.
Yeah, the first time Freddie saw that, he was...
I was shocked.
He was shocked. I thought he was going to faint. Hey, Freddie, don't faint.
That's wild.
I didn't even recognize the woman when I saw her.
She was from England.
She was straight, and she put makeup on because she felt fantastic.
Yeah.
And I walked right by her, and she says, "You're not going to say hi?" I says, "Oh my God, it's you."
Wow.
That is true. Yeah.
So
That's a true story.
Yeah.
Can you tell us a little bit about what it is that you're doing when you give the person the injection? What is it doing to them?
Well, it's releasing scar tissue.
Okay, and how does it do that? Does it dissolve it, or?
No, it just takes inflammation out, and it goes. And really, I'm not interested in why the details are, as long as it works and there's no side effects, which there are none.
Right, and you're not getting people addicted to, you're not a pain doctor where someone's going to come to you and get on, pills. You're a doctor that legitimately is going to treat people's pain and get rid of it.
If you go to someone and to get pills, then you're not getting a proper diagnosis and you're not getting treated right. That's the bottom line. And we've got to, the medical doctors have got to start getting wise here. They have to know why they're referring people. They've got to make a diagnosis. They have to seek out the best there is. I mean, just sending a knee patient to a surgeon is not good enough. Because what does he do? What does the surgeon do, Leah?
Well, he's going to cut you open.
He operates. That's what
right. And then you have to go through the rehabilitation and all of that.
And the meds.
But the rehabilitation, what is that? That is physical therapy.
Okay.
And what is that? Do they know what makes a knee work? No, they don't. It's very hard to do that. You have to get the piece from my website, right?
Right.
Yeah, that tells you all about the knee, what it is, how to treat
And what
it.
website is that, Doc?
Huh?
What's your website? Come on.
No. Pain centers nationwide, or Pannozzo.com.
Or Pannozzo.tv, you can order the
Pannozzo.tv.
I knew he was
right,
going to do that.
That's right. Yeah.
When we get down to the PGA, and he's going to work on Leah's swing and my swing, and shows, because I want to make sure if I'm going to play golf with Leah, I want to at least look good. So I have to go get a new outfit when I go out there.
Yeah, they do have great clothes.
Yes,
in
they
there.
do.
She's going to have a great swing.
Well, you were at one time a golf.
I grew up golfing.
Yeah.
I started playing when I was 6. And then I played for the American Junior Golf Association and the JGA,
Freddie,
the
am I
Junior
going to
Golf
be embarrassed on
Association.
this one?
No, I'm just going to walk around with a camera.
Oh
Yeah.
no, don't please! I mean, I'm going to look so bad.
Well, we're gonna go over her swing on camera.
Yeah, we're waiting
Okay.
until the snowbirds come back in August.
The way we break that up into the art of golf, which is how you play the game, and the science of the swing, the medical problem, the physiology of the golf swing, which is what you use when you hit the ball off the tee. So if you can swing that club at the tee, then you should be able to swing it everywhere. But if you can't get that club hit around, you're not going to do good at all the rest of the game that you play. So now the golf instructors, they know how to play the game.
Yeah, they
But
do.
that's an art form, that's how you think. That's a thinking process. What I'm talking about is the medical process where you have to swing that club head, and all these parts from the top of the head all the way down to the feet have to work in sequence
Sure.
to get that club head over there. So if you can't swing like my friend here,
That's me, by the way.
He just threw you under the bus.
Yeah, but there's just so much that I could do. You can't change the person.
I go there for the drinking and the frivolity that
there
we
you
have.
go. I agree with that.
I like to go for the lunch and the breakfast. That's what I'm there for. I'm Jewish. They give me a free breakfast. I mean, come on.
But actually, you're not a bad golfer. I'm a bad golfer.
Well,
But I don't care.
But you used to not be able to hold the club until you fixed your
All
foot.
right, that's true. I couldn't walk.
He grew an inch and a half after seeing Dr. Pannozzo.
Wow.
Yeah, he put 2 shots in my left leg.
And he wears the
And I have the
arch.
same lift.
I haven't seen you since.
No.
No, but I gotta come back.
Isn't that likely, though, with treatment with you, Dr. Pannozzo?
Yeah.
It's very likely that once you're seen and treated that you won't need to
Yeah.
come back.
Once or twice, that's all. That's why I have a small waiting room. I only have 6 chairs in there. And
Yeah, I've been there when I'm afraid I had to stand outside, so don't tell me you have a small waiting room.
We had to wait in the other waiting room.
We had to go in the other waiting room.
So I have to fix you up quick because there's no place to sit.
Yeah.
I imagine you treat a lot of people that have also already had surgery and it didn't work for them.
Yes, especially people who've had fusions. They have screws and
Oh, yeah.
Don't get that. Fusion, any screws in your back is anathema. Don't do it. You can't get treated after that. You're
You
dead.
can't get treated after that.
No, because in order to treat a pain, you have to be able to mobilize the area.
Okay.
Because how do you get the pain in the first place?
Because the area is not mobile.
It's not mobile because you try to do this and it hurts.
Right.
You try to do that and it hurts. That means it's not mobile, so we have to make it mobile. And you can't do it when you have screws in.
Wow.
And anyway, it doesn't make any sense to me anyway, because a lot of times you're screwed down crooked. Now that's a built-in pain. That's a built-in something. I mean, you never get over that.
It's like the hip surgeries. One leg is always shorter than the other. So
You
how
never know.
aren't you going to be in pain?
You never know because the systems that they use don't take that into consideration. The weight bearing, the physics of it is not utilized by the surgeons.
Right.
I don't know why. They just don't do it. I do it. That's how I treat people.
Right.
It's a weight bearing issue.
Cause of pain.
Pain is a failure to bear weight, inability to stretch. And so you have to redefine things, to make it work.
Can you make a person's leg longer once it's shortened?
You cannot make it longer. I'm not a chiropractor.
Oh wait, we're getting it. Well, we're gonna
There's a segue.
We're going to take a break now, folks, and we're going to talk about that wonderful art of chiropractor. We'll be back in a couple.
Have you ever had a business idea that you thought would be a great solution to tough challenges in today's world, but have no idea of how to get started? You don't want to waste investment money on ideas that just don't work. Introducing Health and Wealth Seminars, a sophisticated advertising agency with over 40 years in the ad business. What makes Health and Wealth different from other agencies is that they fit your product into the public's need. They help put together the strategy of your business before you commit thousands of dollars just to find out that those ideas don't work. Health and Wealth Seminars carries advertising contracts, radio and television contracts, and even a production service contract that will cover all of your business needs. Call today, 954-303-9563, and let Health and Wealth Seminars carry your business to the next level. The number is 954-303-9563. And remember that what happens when you don't advertise is nothing. 954-303-9563 is the number you need to get your business started in the right direction. Pain is the body's way of telling you something is wrong. Surgery can do more harm than good. Pills can become addictive. Dr. Pannozzo uses engineered concepts and weight-bearing physics to resolve this pain and get you greater range of motion. Call today to resolve all those old excuses the medical profession has given you up to now. Call 1-877-927-6969. And now, let's get back to today's show.
When we left, we mentioned that word chiropractic. Well, there was a show yesterday, which I stay up till 11 o'clock, Doc, which is really a lot for me. And
late.
So I'm an exciting guy. If you want to go with me, I got to be home by 11 o'clock to take a nap. Okay. And it was Penn and Teller did a show about exposing certain types of things in the medical field, and it was backed up by doctors. And you've been saying
that's Penn and Teller. It's two people.
It's Penn Jillette and the guy Teller who never speaks. Okay, that's all. Okay, right. And Dr. S. Varick, who's a consumer advocate in the medical community, said this: $8 billion a year is spent on chiropractic. And here's what they say about chiropractic. Not me. Anyone wants, they could tune into Showtime. Go to Penn and Teller BS, it's called. And he said chiropractors do more harm than good. He said it's what he calls it is a very expensive massage. Not my words, his words. He says manipulation has many, many risks involved, which you have been talking to forever. He said your body should not be manipulated, will actually cause you more problems being manipulated, and there's no scientific proof that he has found in his studies that shows that chiropractic works. So all your chiropractors out there that's saying this, I didn't say this, talk to Kenneth Peller and Dr. Varick. So you've been saying that all the time, Doc. What do you think about that?
Well, because I have a way of diagnosing a problem.
Okay.
And what they do is not even related to the diagnosis. Same thing with the physical therapy. Same thing with reflexology, acupuncture. You need a diagnosis. These are fringe elements of the medical profession, and the public's got to be very careful of this. You're going to waste your time and money and get worse. Every time you get manipulated or cracked, that's a bad thing.
And cracking a kid that's 4 years old, they actually, the doctor said they should be arrested for that because the bones haven't even functioned yet.
They should be, like in Roman times, hung on the street. I mean, it's really terrible to misuse your profession to do things like that. I mean, you got to be very careful when you treat people. You got to be very, very careful.
I have a question. What is that popping noise when they manipulate?
I wouldn't go to a chiropractor.
It's one bone sliding on another, so it's a ligament stretch.
So it's popping because it's stretching?
It's the same thing as this.
Yeah, what is that?
It's one bone crossing another, and it's a ligament stretch. It's a ligament injury. What it is.
So you're actually injuring yourself?
Yeah.
Yeah, that's what I'm saying. That when you go to a chiropractor, you end up having more pain in another part of your body.
Yeah,
the body's not supposed to be manipulated like that.
Not only that, but you don't mind somebody trying something once in a while, but they treat you for a year and a half, no improvement. They won't send you out.
It's not improvement.
Yeah.
It's just relief of pain.
They don't relieve it.
No,
And
they give
have-
you the electrical muscle stimulation,
Oh,
which people, tend to feel good for a few minutes. Yeah.
I have that. I've been using that, Doc.
A TENS machine?
Yeah.
Yeah, TENS unit.
Yeah.
Freddie,
I've been using it.
you know
I
better
wanted
than
to
that.
see- well, how am I supposed to know if it's
That's
going to
right.
work if I don't
You got
try
to learn
it?
so you can ask the questions. I agree
tell
with
you
you.
something. The first time I used it, it zapped me. I thought I had to go to the emergency room.
Fred, I've never prescribed one. This is like
Absolutely not.
47 years of practice, 3,000 patients.
I think it's a little higher, but we got to change the
I've
ad now.
never prescribed one of those at all, ever,
Well, I can see why.
because I didn't like the idea.
I like the buzz.
Oh, you like to...
I put it on my shoulder. I
There are
ran.
other places that are better to put it on.
No, not that thing. That thing could burn you up.
What about ice and wet
No,
heat?
forget all about that.
So all of that is just
None
myth?
Yeah, none of that works.
But it sells pills.
Yeah. Aspirin's your best drug. If you have a bottle of aspirin, you got everything.
Interesting.
And painkillers only are blocking the pain. They're not relieving anything.
Right. Unless it's an anti-inflammatory, which aspirin is.
Mm-hmm.
I've always been told that, or not always been told, but I was told once that if you take pain medication that you end up risking injuring yourself even more because it masks the pain and then
That's
you
right.
feel like
That's
you're
true.
better, so you're kind of out maybe running around more, bending over and picking this up or that up just because of the pain medication and then you're
Well, it's
in
not
a
that-
worse off situation. No.
Not that stark.
Yeah.
But if you have a pain that lasts a week, then you have something to get evaluated.
Right.
Don't waste time.
Right.
Well, what about cortisone? I have a bad shoulder, and they put cortisone in there.
Yeah. Well, what they're doing is putting the orthopedists. I don't do that, but the orthopedists will put a powder form of steroid in your shoulder. But that's not where the problem is. The problem is outside the shoulder, not inside. There is no problem at any joint on the inside. Now, here's a typical example. This picture I was showing.
Now remember, you're on the radio, so.
No, he's streaming it.
Hold it up.
I'm streaming.
You
He's
are
streaming
bring it down,
as-
but you got to explain it. 'cause
Yeah,
he holds
explain
up,
it.
He doesn't explain it.
All right. This is the picture right here.
Okay.
All that around
There's a picture.
the knee is the connective tissue, the ligaments outside the knee. On the inside, where's my finger?
Okay, now the
Right
doctor's
there.
describing the patient for all of you people on the radio.
And you have to go to Pannozzo.tv to see this.
Yeah. Okay, Doc, get back on the mic. Get back
That's
on the
the
mic.
cartilage. So you see where it is.
There you go.
The cartilage is pink.
In
But,
college.
so that's not the problem. It's a flat cartilage. So there should be no knee treatment, no knee surgeries ever. There is no need for it.
Well,
It's all a ligament outside, and you can get to it. It's right under the skin. And
Well, I
isn't
got
if you have to go to
I got a
Mars to get
unique
it.
question for you then.
I mean, that's just taking the public for a ride. I think all
Well-
those surgeries is not necessary at all.
I think what's really interesting and what people should know about you is that you've been doing this for so long. It's second nature for you to know where pain is coming from, to diagnose it truthfully. So it's not that you don't have time for all of the lollygagging and all of the excuses and all of the information, but you're very matter of fact. And I don't know, it's kind of hard for me to explain. You're very good at what you do. You know
yes.
that you're good at what you do. You believe in what you do, and you're helping
Oh, yeah.
people every day without having to go through surgery. People every day are getting knee surgery. People every day are thinking, I need to go to a doctor to see my knee. You need to call Dr. Pannozzo. He's saying no surgery ever.
And no narcotics.
And so why wouldn't you ever want to go and see a doctor that is doing that in your best interest? No
Well,
surgery, no drugs, no rehab.
Well, here's a problem that if you go to somebody and they say, well, take this therapy. Well, the therapy is going to hurt you. So you get worse, then you go right back to the surgeon and say, I'm worse. You've got to operate. I can't stand this pain.
Right.
And that's what they're operating for, pain. Okay? They're operating for pain.
Right.
Now, if you're going to reduce the pain, why do you have to do surgery? You don't need it. Now,
So
you
is a
follow
lot of
that-
the
you
pain that
follow
we...
that reasoning?
It's easier to understand coming from you.
Well, a perfect example. Heidi's husband had two knee surgery, one knee surgery, and I brought him over to see Dr. Pannozzo because he had to have the other knee done.
Okay.
He gave him 2 shots. He didn't have to go for knee surgery. He said, "How come you didn't tell me about him sooner?" I said, "You didn't tell me you were going for knee surgery."
Yeah.
So he stopped him from getting a second knee surgery, which I think is amazing.
Right.
And he felt no pain at all.
I have a sister-in-law who was opting for surgery. I think the fusion that you were talking about
Send her in
her neck and her back, and I kept telling her that you need to go see Dr. Pannozzo. You need to go see Dr. Pannozzo. She went through with the surgery.
Of course.
Here we are 7 weeks later, and she's in pain still. Her back is still bothering her.
Amazing.
She didn't have anything. I've told her again, you need to go see Dr. Pannozzo.
I got a friend of mine who's listening today, and I told her, I'll take you in to see you. And she refuses. So they're going to have an MRI. I love this. I'm going to have an MRI tomorrow. What's an MRI going to do, Doc?
Nothing.
Yeah.
So why are doctors
It's ordered, listen, check the reasoning process there. It's ordered by a person who doesn't know what's wrong with you. He's looking for somebody to tell him what's wrong with you. That's why he orders an MRI. MRI is read by a radiologist who does not treat this stuff. All they do is read images. That is not good enough for me. They can tell you whether there's a cancer there or not, but they can't tell you where the pain is. And they don't tell you where the pain is. They read each segment, and you have to interpret that. So in other words, you have to have a knowledge. So far you have 2 people without a knowledge of where back pain occurs. The report is read by a third party, perhaps, and they don't know what it says either. They're looking for a direction because they don't examine the patient. Now, this is information for all the people who are listening. I mean, this is really good stuff. If somebody doesn't examine you and doesn't know what's wrong with you, and he orders an MRI, you got to leave that because that is not a situation you want. You want somebody knowledgeable who can help you. Okay, the third party who reads that doesn't know what to do with it either. So he'll read, oh, you have a bulged disc here, so you need a surgery here. That's wrong. MRI should be wiped out.
I think MRIs are something that are they're recommended by chiropractors on a daily basis. You go and you get treated for a chiropractor. A lot of the people come to them for workman's comp injuries or car accidents, and they want that permanent impairment rating so they can get some money from the insurance company. And the next thing you know, they're like, okay, well now we're going to send you for an MRI when you've been being treated by this chiropractor for 18 weeks. And
Did you know that the system in Florida where you have a counselor who directs your care directs you to a chiropractor?
Did I know that? No.
You know that?
No.
Well, you know it now.
Yeah.
They direct these patients to where they want that money spent. And that's not right. Patients tell me that. I want to come to you. And I said, well, you have to get your counselor to approve it. And they don't.
Weird.
So they're building in disabilities, and they're building in surgeries, and they're building in a lot of money that's paid by these companies for no reason at all. You don't have to have injuries in your company if you know who to hire. You have to know who to hire for the occupation you have to fill. And we do that. I had 2 nursing homes in my own career, and we never had injuries for 3 years because I examined everybody. I knew what pain, how to examine for a pain. Now, these companies don't. They have workman's comp companies that you can go to that they force you to go to. They don't have any special knowledge, those guys. I mean, the whole thing's a farce. When you look at it from a position of cause and effect like I do, then you can see that there's a lot of things wrong out there, especially the state system. It's not right.
Well, it's tough to change the system. And this has been around for years, Everybody believes what a doctor tells you. Doctor says you got a bad foot.
Well, these are
take
counselors
pill,
now.
Why should
a counselor tell you where to go for treatment?
You're right.
If you have the qualifications under the state law to do certain things that you advertise you do, they have no right not to let you work. What right do they have?
They don't.
Well, they're exercising it. So who's speaking up for us? How about the HMO? They have a certain amount of doctors in there, and if you're not on that list, well, who determines the list?
Right.
Are they better than I am?
No.
No.
Well,
They're
I would
not.
think being treated by you and being done one time would be better than going to a doctor for 18 weeks and being referred to, 7 other doctors.
Exactly. Insurance company would benefit. You're right.
The reason I'm talking about this is because people got to wise up. You have to know what you're buying. You have to know what you're buying. If you think an HMO is cheap, you have no reason to think that, because once you get sick, you're going to want to be the one that's suffering because you don't have any ability to move from place to place. They tell you where to go, and if you don't go, they don't pay.
Yeah, my feeling is this, Doc. I mean, to me, I don't care if I had to pay out of pocket. I think everyone here would feel the same way. If you could be cured, it's a quality of life.
Well, that's the thing. It's a quality of life, and it's your money, and it's your life.
Right.
What are you having somebody tell you what to do for? I wouldn't do that.
Well, I would bet my dad's dollar. If you give out the phone number, somebody calls up and tells us, I question my doctors when he said, I have this. I want to know who says, Doc, I question that. I don't believe that. And nobody does that.
Here we go, buddies. 877-927-6969. You got a chance to talk to Freddie, Dr. Pannozzo. Me, you don't care about. And we are from the Love Doctors. 877-927-6969. And if you don't want to call, remember, call after tomorrow. Monday, call Dr. Pannozzo at 561-381-5800. And now back to the show. Go. What else, guys? Anyone else have a problem or something that a person they know about that they want to talk about? Because let me tell you what this doctor said again about chiropractic.
Here we go with the chiropractic again.
I can't help it because...
You're going to burn your car in the parking lot last
Huh? My car isn't worth that much. It doesn't really matter. The risk with manipulation, he says, causes fractures to the body. The body is not designed to be manipulated. Is that true?
Yeah, we've discussed this before.
It's amazing. Then why do they do it?
Well, a lot of them don't do it anymore. They do massaging, and they do ultrasound, and they do stimulation.
Yeah, they got water boards
when
now.
When you're laying down and they bring a machine over that pounds you like this, bam, 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 walk away from that. That's nothing. They don't have a diagnosis. You need something that's really a solid diagnosis before you can get treated, right, Leah?
Agreed.
You follow the reasoning. And I'm not criticizing anybody in particular. It's the reasoning process you have to have that determines how good you do with your health.
What do you think about the massaging for pain?
No, you can't massage for pain.
Don't massage. So what do you think about massages in general?
Well,
is it something that you could go and just do to enjoy?
You know how I feel about that? Dark room, candles, wine.
Well, there you go. It has
okay,
use.
so those are the only types of massages. If you're feeling pain, don't waste your time going to...
Don't waste your time, no.
Because it's really not helping you.
No, and they're overselling. They're overselling themselves. There's another thing. We call this ancillary personnel. Trying to help us. They want to take it over. That's what they're doing. They're trying to take over the business. You can't control a physical therapist, no matter what you do. I had one call me the other day, and he said, "I'm rescinding your order."
Yeah,
you don't have any right to do that under the law. Who the hell is this person talking like that? They're supposed to follow orders, but they don't because they have political power. And well, that brings me this lady in the nursing home.
We talked about it.
If you have people, ladies, men, sitting in wheelchairs all day, and they walk 5 steps and 5 steps back, and they sit in a chair, they call that therapy. Get them out of that place. You're being cheated right and left. These people are doing nothing but sitting around. Maybe they're overworked. I don't know. But I used to own 2 nursing homes, and I could tell you, I directed the programs myself. And we actually had empty beds because we sent people home.
That's what you're supposed to do.
Wow.
That's what you're supposed to do. But right now, if you start discharging people, they'll say, you can't discharge anybody. We're going to fill that bed. I mean, the whole thing is this. You got to be more ethical, morality.
It's about making money, Doc.
Morality, yes, you do make more.
I mean, you treat more people, there'll be more money in the system, wouldn't there?
Not the same ones all the time.
That's right.
New ones all the time, and you do much better than treating the same ones all the time.
Well,
the word gets around, you go in there, you never come out.
The federal government could use your help.
No, the federal government doesn't want his help.
But that's just it. Even they're giving out money.
Yeah.
And they make money giving out money.
This is where the politics comes in.
Exactly. So it's better to have a system that doesn't work that makes money.
When I worked in Ohio, this is every story we tell you is true. A General Motors company, and the union wanted me to have a contract with the company to do all their rehabilitation work. Because I had the techniques for it, and we didn't have anybody off work. This is a serious business. You've got to go back to work. And so they negotiated, and I was the only one that's able to do this for the plant. And you should see the hue and cry from every chiropractor, every DO in the world. They were screaming about how they weren't getting the work, but they were not qualified to get the work. But people got to be knowledge of who's qualified to do what. And if you don't improve, even in my office, in 2 or 3 days you're not improving in my office, you got to go somewhere else.
I mean, that's
Does that happen ever, Dr. Pannozzo?
No.
I mean,
that too.
Yes, we have people who go come in there one time and then go somewhere else, but it's usually based. I don't know what it's based on.
Sure.
But, you have a percentage of those.
I know you've had a lot of success with patients with scoliosis. We've talked a little bit on the phone outside of outside of work, and as well with people with migraines, which I think is
I'm glad you brought that
amazing.
up.
Dr. Rich, who I work on the air with, gets migraines all the time. I've known a lot of people. My grandmother had them all the time. She's now gone. My Uncle Bob has them still to this day, where he's debilitated all day long. He has to be in a dark room. No one can talk.
That's ridiculous. Just drag him out of the dark room and bring him over to see me, because you don't need to be in a dark room. Migraine is based on COC1, which is the base of the skull and the first bone. That's where the problem is. And if you can treat that, then that migraine goes away. No pills, no nothing. It'll just go away. You can even stretch it out with your thumb. I mean, there's no reason to have these migraines with these expensive pills and disrupt your marriage, your work, everything. It's not necessary. You don't need to do that.
And then the likelihood of it coming back is...
It does not come back, no.
Mm-mm.
That is unbelievable.
Like, Les here was watching his 28-year-old
Unbelievable.
Man. And his mother brought him in because he was so headachy.
For 20 years, he had such pain. He was taking every medicine out and didn't work. It didn't work. I was there. I watched this.
Yeah.
And his liver, meanwhile, wasn't doing so well.
That's out your liver, sure.
So I took a film and I found out which side that COC1 was on, and I put a shot in it, and that was the end of it. He walked out, no pain, never been back.
No,
no pills, nothing.
What happened? What else you discovered with him? I think it's happening to everybody in this country. TMJ.
Oh yeah, TMJ also.
Is something that causes migraines?
No, it causes headache, but in the front.
Okay.
Yeah, on the side.
Yeah.
And migraine headache is specifically back there, right there. Goes in this
back of the head
section right there. Can you see that?
Yeah. It's just incredible that you're able. I mean, there are so many people listening right now that get migraines.
Yeah. Oh God. Yes.
Well,
561-381-5800.
Yeah.
Call the number.
They're oversold by the neurologists who don't understand musculoskeletal treatment. You know, that's not taking nothing from them. They're supposed to be doing neurological diseases, which I don't know. But I know how to treat a neck.
Oh, we've seen it.
For a headache. So, and they're not trained that way. So, and I train myself. A lot of these techniques are inbred with our own offices from here in Phoenix.
Well, you just dissected a brain.
Yeah, I actually went to...
That was last brain.
Yeah, was last
there somebody connected to that?
Yeah, there was a story connected to see this migraine. So I suspected where it was, so I wanted to see it. And I called a medical school, and a professor took me through and actually was there for me with an hour and a half, and we dissected that. And like I tell everybody, you need evidence in order to treat. You can't just imagine it and treat an imaginary thing, which is what migraine is. So now I went to the term migraine. So I went to see it, and it was right there, nice big joint, and that's how we develop these things. So you have to have an idea. You have to do the research. Now, people who don't think like I do, they're going to poo-poo this.
Of course.
But they're wrong, because if they send somebody in, check it out.
Do you know how many people think that their migraines are hereditary?
Yeah.
They think it's in the genes. They think, oh, my uncle had it, my grandmother had it, and that's why I have it.
Well, you know, that migraine term is ubiquitous. I mean, I'm telling you where it should mean. But most people don't use it like that. It's any headache is a migraine. You know. Oh, I have a migraine. I got to go lay down. You know. So or
head on the toilet seat.
I want to have sex tonight, but I have a migraine. You know, I can't do that.
Oh, I heard that before.
Yeah, there's no sex with migraines.
See, a lot of people won't come see you.
Yeah. A lot of guys are going to be sending their wife there.
Say, don't go see that guy. Let's go see that guy right now.
That's your problem. You said that point in. I'll fix it up.
I'll fix it up.
And you got Leah from the Love Doctors. That's kind of unique.
He's even fixing marriages.
Yeah, Dr. Pannozzo could fix marriages. So, guys, if your wife is suffering from a migraine, call 561-381-5800 and talk to Dr. Pannozzo.
The myth goes on, you know, like they use Botox for muscles. I mean, muscles have nothing to do with a migraine or a headache. It's not muscles at all. So that's a waste of time and money. Those guys should stop that.
Where do you put Botox for a migraine?
Yeah, they're doing it now.
They just do muscles. Muscles everywhere.
But you have to come back every 3 months for another shot.
But what does it do?
But it doesn't do anything. No, it's not muscles at all. It's ligaments.
So they're putting...
First of all, it's a ligament, not muscles. So the structure of the body's wrong that they're treating. But they don't know that. They're not trained in musculoskeletal. People with that treat, treat with Botox, what are they, dermatologists?
Dermatologists, yes.
What do they know about musculoskeletal pain? They don't know anything.
I can't believe that people are getting Botox injected into their muscles.
Yeah.
And what is their said purpose of that?
Relieve the muscle, relieve your headache, but muscles don't cause headache. It's ligament.
This must be Miami, because I see people put...
No, it's all over. Botox is going live their campaign.
You know they can't fix a flat?
Yes.
They put it in their butt.
Yes.
To get butts?
Yeah.
Have you seen that?
Yeah.
And it moves around and all that?
And that lady was sued.
Film on that.
She was sued.
Wow, that sounds really tragic.
Yeah.
There's a doctor right now. They just discovered he was doing it. And the damn thing moves.
I've never heard of it.
It's the most disgusting thing I've ever seen in my life.
I'm shocked that someone thought that was a good idea. Fix a
shocked that
flat
anybody
in
would
your
do it.
butt.
Fix a flat because it gets hard like a rock.
I would be out of that office so fast. What? Fix a flat.
I think people should really, instead of enhancing their body, they should enhance their personality
and their minds.
You know, the best way that I know of to make yourself happy is to make other people happy.
You're right.
If you can do that, you have achieved something that is really rare.
That's true.
And it makes you more attractive.
It definitely
and
does.
It's all in the eyes. If you're interested in someone, they will be attracted to you. You don't have to do all this crazy stuff. I mean, it's just useless.
It's real, Doc. I got film. I'll show it to you. I couldn't believe it.
It's everywhere.
It's crazy.
It was all over all the TV stations. They found this person and putting him in jail, and he's being sued for millions. And here's what I want to tell everybody. I mean, this is something that everyone should know. Start thinking about what's right and what's wrong. Here is a medical doctor. This isn't someone that just got up and decided he was going to help any people. He's a graduate of a prestigious medical school, Ohio State. Make your second opinion your first with Dr. Bennett. See him. What do you got to lose? See him. What do you lose? A little time? What do you got to lose?
Exactly.
Well, when Les took me to meet him the first time, I said, you want what? This guy's going to who? I'm out of here.
We all did that when I first met him. I said, and I've been with him for a long time, and I have said to myself, my God, this guy should be in the Hall of Fame. I mean, he has helped people that came to that. The guy with the wheelchair, that went from a wheelchair to crutches to a walker to now he's just walking with a cane.
Unreal.
Yeah. I mean, come on.
That happens all the time.
Yeah. We're going to take our last break, Freddie, then we'll come back and we'll finish. So, everybody, call tomorrow, which is Monday, 561-381-5800.
Call-in number?
And the call number is 877-927-6969. 877-927-6969.
Please welcome a new sponsor to the show. It's AMP2 TV, the first and only internet network that's truly plugged in. When you're looking for a full-service internet television production company, discover AMP2 TV, a full-service production company that can provide all streaming videos in studio or remotely. They offer web page development, and they use all the latest platforms to help make your business selling points more powerful. They can do remotes and live streaming, as well as tape productions. Let AMP AMP2 TV handle all of your television production needs. Choose from a variety of creative TV and radio packages and see why AMP2 TV works with many major companies, including Comcast, Bravo, and Fox 29, as well as individuals and businesses of all types and sizes. To see samples of their work or to find out more, visit their website at amp2.tv. That's AMP, the number 2.tv. Or call them at 1-866-224-5422. That's 866-224-5422.
You're listening to Dr. Pannozzo's Sports and Medicine Hour with Dr. Anthony Pannozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-877-927-6969 to get your pain issues resolved. And now, more of Dr. Pannozzo's Sports and Medicine Hour.
We are back, and our producer, Freddie, just got a tweet in from someone. You might say what it was, Freddie?
Yeah, they went to have an MRI done, and they came out with the bulging disc story. So can you elaborate
Bulging
for the
disc.
listener?
Yeah,
what that
well, it's hard to evaluate that, but it really means one bone sunk into another. So we used to call that we called it, I've forgotten what it
Oh, my God, we stumped the doctor. It's never happened on the show. Oh, my gosh.
It's called a bulging disc.
Bulging disc is a medical term.
It's called a subluxation, where
there we go.
the bone above moves into the bone below and causes the bulge. That's the best I can do on that. But it's not to be read like that. The bulging disc is not to be said. It should be read as a subluxation so it can be treated. Can't treat a bulging disc because that's not a diagnosis. The subluxation is, so you can treat that.
What is subluxation?
One bone slide into the other.
Okay.
So,
Okay.
so your spine's crooked. That's the basis of scoliosis. So it's all kind of involved with each other, and we do treat scoliosis and subluxations. We treat all that, straighten people right up, and we talked about this in the last couple of segments. It's absolutely true. Try it, especially 18-year-olds, 16-year-olds, 14-year-olds who have a curvature. Those are treatable. That's no reason to go to drop the level of care to go to therapy or chiropractic or anything like that. No, go to a doctor who knows about it, like me, and I will teach anybody. Anybody wants to know how to do this, I'll teach them for free. All they have to do is come in and ask me. Because I can't treat 9 billion people in the world. I can only treat a few.
Just keep yourself healthy. We'll do it. Yeah, we'll keep you healthy.
Okay,
One person at a time. 9 billion times.
Well, Doc, here's something funny I came across today. It's not even a doctor. It's called, I can't even use the name. They say that with acupuncture, they could get rid of scoliosis and spinal stenosis.
Acupuncture.
I'm trying to figure that one out. How could you
Must
do
be
that?
an air bubble in the body. So they stick a needle and then it comes out.
I have trouble understanding that. I mean, that's. I don't even want to answer the question. How's that? Because it's so ridiculous that acupuncture in your nose is going to cure your scoliosis.
Acupuncture cannot treat anything.
That's what I figured.
Period. It should not be done. They brought that out. You remember how it worked? You know, I watched it develop. Some editor of the New York Times went to China, and they used acupuncture to do a surgery on him.
Wow.
And so he came back and wrote about this, and they developed the physician's assistants that you have from school now is based on that. And it is wrong. These people are not trained. There is nothing in acupuncture that has any good for you at all. What does it treat? It doesn't treat anything.
It's just needles in your skin.
Well, that's where they got this, the thing you used.
The TENS unit.
The TENS unit, that's where that's based
Oh,
on.
really?
Yeah, that's based on that. So you twirl the needles, and I studied this. And you ought to hear a funny story. Now, it's a tragic story, actually. I traveled to New York, and where they had a presentation on acupuncture. This was early on. And the French were doing it.
The French.
And, they brought these Frenchmen
French are
over.
doing it.
And, when I go to some of these things, I sit right there in front. I don't sit in the back, waste time. I'm there for the purpose. So I'm listening to this, and they bring the patient out, and they're talking, and they start doing this treatment. I said, they don't even know what's wrong with that.
I know, that's what I understand.
And I do. And I was sitting in the audience, and I knew what was wrong with them, and they didn't, and they're using acupuncture. So I said, you know what? This whole thing's a fraud. I'm leaving here. I saw 2 Broadway shows that day. It was the best.
How can they find the cause of pain? That's what I
They
understand.
don't know how to do that.
Doc,
so
why don't you
therefore
just
the
get up and
treatments
give the guy an injection, take all those needles out?
Yeah, I should have. I mean, you know.
And they even say they could cure shingles. You can't cure shingles
Yeah,
with putting-
shingles. A
Shingles with
acupuncture.
A virus with
But
acupuncture.
I'm glad you said that because we're working on a treatment for shingles.
You worked it on yourself, I remember.
And it works.
Yeah.
So if you
Really?
have shingles, you have those pains, just come in. We'll knock it right out.
I had
He was a
shingles.
test subject because he had shingles and
I had
was it
shingles.
Paul? Oh, shingles is a terrible
It was
thing.
the
Thank
worst thing in
God.
my life.
Yeah.
The worst.
Yeah,
works.
there's nothing worse than shingles. I know people that have had it. Ooh,
Very painful.
yes.
And you can get it again, correct? Doc?
I took
there-
a shot.
But there are
The
other
anti-shingle shot.
there are other things that cause that pain. It's not always shingles. So you have to know a lot to do this treatment right.
Really?
Yeah.
What about flat foot pain? I know that we've talked a little bit
no
about
problem.
that.
Yeah, no problem.
That's amazing because people with flat feet, it's not like they can change their anatomy. They're not going to all of a sudden not be flat-footed anymore, but they
Yeah.
can come to you and not have to deal with the pain anymore
Well,
because
we
of the way
can-
you treat them.
We can treat the flat feet and get the arch back. You know, your
Really?
a medial arch. Yeah,
Wow.
I had no idea. You can actually bring an arch back into someone's foot.
you bet. Yeah.
Wow.
Is that amazing?
That is
Amazing.
unbelievable.
That's why you
We
did
do
for me,
amazing-
Mark.
I didn't know that.
You
That's
know,
crazy.
We do a lot of amazing things because we do the research on it. You know, it's the doctor and the patient. There's no facility that I can send you to that I want you to go to. I will do the work myself. That's how you learn.
Right.
And you got to be. And I got a good background in physics, chemistry, languages, everything. It's just. I mean, that's what you use to treat in the musculoskeletal system. So that's what you see. I mean, and it's not easy to understand either. All you have to do is ask. Any of the doctors out there, you want to know how to do it? Ask me. I'll tell you.
Yeah, Dr. Pannozzo doesn't mind sharing the secrets. He would love very much for people to understand what he does so they could help other people. He's
Especially
only one man.
Especially with scoliosis. I think
Yeah.
there's 6 million a year or something. Like that.
6.2 million a year was the latest. That
Is
was
what they
done in
diagnosed.
2014.
And these are all from trauma. They're falls, they're sports. And they'll show you charts of families, but the families are all in the sports.
Yeah.
Yeah.
So they don't even ask that question. But there is no genetics for scoliosis. It's all trauma.
You know, Doc, I was a catcher for 18 years, and I have flat feet. And the damage now, I'm 52, the damage is unbearable. That's why I went to go see you, and I said, what do you mean this guy's going to give me an injection in my feet? But that took away the pain. And what I want you to develop is a way to get the shoe to have those things that you use. The shoe should have it all the time. Because there are times I forget it. There are times that I leave it in the other shoe. So if it was permanently placed in shoe,
Well, that's something we can work on.
We're still working on the pillow.
Dr. Scholes does it.
Well, yeah.
And I don't think they know what they're doing.
We call it Dr. Pannozzo. And the
Pannozzo
ladies will
shoe.
call it the Lee. I mean, we got names for everything here.
The Pannozzo shoe.
Yeah. Well, Dr. Pannozzo is working on a pillow for people that have migraines, a certain pillow we would get, well, we're not going to talk about it yet, but there's a sleep person.
Sleep person.
For lack of a better word, sleep person. I mean, how many people suffer from migraines that can't sleep at night? I mean, my God.
Can't do anything.
No, I mean, they're in such pain. It's devastating. I've known people like that.
I've had a few. I've had a few
Yeah.
migraines in my life. I mean, I certainly know the difference between a migraine and a headache.
Oh,
They're
Injury to the spine?
debilitating. It's
Yeah.
a miserable way to live. I've
Yeah.
watched my uncle and I watched my grandmother suffer for years. Call
Spine
Dr.
injury, yes?
Pannozzo. It's all you have to do.
Spine injury, migraine?
Yeah, it's all from the neck.
Yeah.
All headaches are from the neck. You see, you can tell if there's anything in the brain.
Right.
You just do a CT scan. If it's normal, then
Oh, I see
it's
what
all
you're
from
saying.
the neck. See, just like that.
Yeah.
You told a lady, a swimmer, that she had a spinal injury. She couldn't remember. And then she went home and she says, Dr. Pannozzo, she called you. And she says, you know, you're right. I had a
mean,
spine injury.
Of all the things I've seen him do over the period of time that I know him, the thing that blew me away was this kid with a migraine. I mean, I tell it to everyone, it just blew me away. This poor kid was in pain. His married, his marriage was going almost apart. The mother says, you know, I saw him on TV, and I heard him on your show, and she came in, and kid hasn't been back. The migraine was
Oh,
done.
wow.
the
That
kid
is
is-
so wonderful.
And I looked at him and I said, oh my, I said, you really? He said, oh my God, you're like a god.
Wow.
Came back again for the TMJ. I mean, it's amazing.
He came back for TMJ.
Yeah, for the
though, not
TMJ.
Bennett.
No, he came back for the TMJ.
Wow.
Amazing.
And now the doctors have the TMJ where they stick that $2,600 thing in your mouth. I couldn't sleep with something in my mouth all night. I really couldn't.
No.
The dentist won't get with it. They'll prescribe those things instead of referring to TMJ for us to treat that. And it's one day. It's a one-day treatment. TMJ, bang, bang, done.
Well, folks, it looks like we really, really had a good show today, and we really talked more than we were supposed to. Leah, thank you so much for coming here.
Thank you. It's a pleasure.
If you want to call Dr. Pannozzo, call Monday at 561-381-5800. We'll see you next week, and thanks for listening.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys health. Centers nationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineered concepts for the body.
Real Radio 94.3.